Question 67. Which of the following is the most likely underlying diagnosis? Panic attack, MI, PE, pneumonia. Okay, so kind of all over the place. Maybe respiratory, psych, MI, cardio. Don't think too hard about it. A 33-year-old woman presents the ED with a sudden onset shortness of breath and chest discomfort. Chest discomfort and shortness of breath. She states that the chest pain worsens when she inhales deeply. It could be a sign of pleuritis. She also reports a brief episode of lightheadedness while walking upstairs earlier today. Yesterday, she returned to her home in the US after a vacation in Greece. Buzzword, past medical history is unremarkable. She does not smoke or drink. On a physical exam, her respiratory rate is 26, pulse is 108, blood pressure is 124/82, and oxygen saturation is 92%. She appears mildly anxious, but is speaking in full sentences. Lungs are clear to auscultation bilaterally. Diagnosis. Panic attack. Don't rule out panic attack right away. Always consider it because it definitely can be real. However, in this case, panic attack is a lot less likely when your O2 sat is 92% and there's no history of COPD. So I'm going to put this one lower on our list. Also, respiratory rate is 26. The most sensitive vital sign to acute illness is respiratory rate. But then again, panic attack could also just have tachypnea. The weird part is tachypnea with decreased O2 sat. How about an MI? So we don't have EKGs, we don't have troponins. We have chest discomfort, shortness of breath, and this pleural pain is interesting. So pain with inhaling deeply tends to be pain of the pleura themselves. The pleura rubbing against each other can cause a little friction if they're inflamed, and that can be painful. So this might point more towards a respiratory clinical picture. Blood pressure is normal though, 124/82. If she's having an MI, we might expect that to be lower depending on the severity of the MI. And a couple more things. MI in a 33-year-old woman without any unusual family history of it is pretty unlikely to happen. We should start suspecting MIs once women are 50 and above. For sure, should be a little higher on your differential list then. Or if there's any significant family history at an early age. And then the next one is vacation in Greece is an odd one. This might be hinting more at the next part, or letter C, which is our pulmonary embolism. So PE, this one is really important. I would strongly recommend being at least familiar with the Wells score. This can help you out a ton on test day, especially on level 2. Usually on level 1, they make it pretty obvious, but on level 2, it's very helpful to have your Wells score memorized, or at least some of the big parts. The biggest parts would be evidence of DVT, which is 3 points. If you believe a PE is the most likely diagnosis, that's also 3 points. That one's kind of bogus and subjective in my opinion. So this one, this second part is a little harder to standardize, but other great ones would be heart rate greater than 100. So any tachycardia at all, 1.5 points right there. Recent immobilization or surgery. Now in the Wells score, the immobilization has to go on for at least 3 days-ish. But what I've seen more commonly on tests is just any recent immobilization. It could be a long car ride. It can be a transcontinental flight like this, which is still several hours. But typically the immobilization is a little more flexible than the actual Wells score makes it out to be. And then surgery is another big one. Surgery is essentially immobilization for a prolonged period of time. Then there are some other minor ones, hemoptysis, prior PE or DVT, and then cancer. Cancer is just part of Virchow's triad. It increases your coagulability. So people with cancer are hypercoagulable, which is why that's an extra point. So let's see what she's got here out of this score. Let's skip the top two for a moment. Heart rate greater than 100. She definitely has that. So she's got 1.5 points. Immobilization, assuming we're ignoring the 3-day rule, then she's got that too. She's at 3 points already. I don't believe she has any of the other symptoms. And then if you again, very subjective, PE most likely diagnosis. I think it is. So yeah, I would give her that 6 points. But if you're not sure, she still has at least 3 points, which is pretty good. Usually around 3 or 4 points and above is moderate to high risk. But definitely keep PE at the top of your differential list in this patient, even if you don't give her the full 6 points. So let's see if there's anything better than that one for now. Spontaneous pneumothorax can happen with flights. The changes in cabin pressure can cause pulmonary blebs to rupture, and thus you can get a spontaneous pneumo that way. However, it's typically in people with risk factors. Think tall, thin men for some reason, people with pulmonary disease like COPD or cystic fibrosis. Just imagine that their lungs are thinner from damage over time and that they can have these little soft spots that kind of bubble up and eventually burst. And that's what a bleb is. It's essentially like part of the lung here, there's a little bubble, and eventually it ruptures and air spills out into the pleural space. So she really doesn't have the risk factors for it. Everything else, though, sure, that's fine. Shortness of breath, decreased O2 sat, that's all good and well. It's just she doesn't really have the risk factors. That one's lower on my list. One more reason it's not spontaneous pneumothorax would be the clear lungs bilaterally. That's kind of the antithesis of what you'd expect for pneumothorax. You would have hyperresonant lungs to percussion, and you would have decreased breath sounds on the side with the pneumothorax. And then pneumonia, they didn't mention exposure to sick contacts, and this was sudden onset. Acuity is very important. Pneumonia would probably take a little longer than quote unquote sudden onset would be. Think at least several hours to possibly days to develop. So that one's out for me as well. No temperature though, and that was intentional to make you have to think about the acuity. So correct answer here, Wells criteria says she has moderate risk, at least if not high risk if you gave her the full 6 points. Correct answer is C,